Hi, Dr. Patricia Ramos here with Network of Medical Audiology Professionals, and with me today I have Paul Harkness from Lantos. So Paul, tell me a little bit about what's going on in your business today.
Thanks for having me, Patty. It's so nice to be here with the group. So Lantos Technologies has come back to the market February this year, so just a few months back, and we're doing a really good job at providing medical and private practice audiology and hearing care specialists something tangible to help them differentiate their practices with our 3D ear scanner.
So in that 3D scanning space, we in our industry, we kind of gotten into this quick fit, right? Mm-hmm. Do we really think that that's best for the patient?
I think all of us know that it's not. Mm-hmm. And studies would show, recent ones even, that 80% of people that walk into the office looking for professional help expect to get a custom device. And you know from your practices how few actually end up with them. It's 20% or less these days. So it's our belief that while we spend a lot of time customizing the algorithm that goes into the hearing aid to give them the perfect algorithmic fit for their hearing loss, we then deliver that oftentimes with a non-custom device, meaning that they're not getting all the benefits that they normally would get. So we think we can help solve that. And we also believe at the same time, we're going to give practices a really strong means of differentiating themselves against non-professional ways of getting hearing health care.
Well, I believe that too. I think patients, they want that custom experience, right? Because everyone's not the same, right? And every ear is definitely not the same, as we know. And so I think that one of the things that I think is unique about Lantos from the scanning standpoint, and you tell me how you feel that impacts things, is the pliability of the membrane and how it really looks at the compliance of the ear canal as well. How do you think that has an impact?
It's a good question. So we're not the only scanning company out there, and that's great. We want scanning to be standard of care. We are the only scanning company that uses this balloon membrane to grab the digital geometry of the ear. That's very unique. But as you said, it does act as a proxy to what you'd get from putting silicone in their ear without that potential uncomfortability. It also provides unbelievable accuracy, and it's hypoallergenic. So in this day and age, with some of the focus on germs and challenges around that, we remove all of that. It's a one per patient use, which has also been a phenomenal win for practices.
So Paul, we've been talking a lot about the custom experience for patients. I believe that we have seen, for a variety of reasons, people wearing things in their ears all the time now, right? From AirPods to when they should be wearing custom noise protection plugs and things of that sort. Do you see that Lantos can be that stepping stone to being able to reach that patient population where we're all putting things in our ears now? And what do you believe that can bring for the patient?
Yeah, I'll talk about it from both standpoints, but if you think about it from the practice standpoint, taking one 3D ear scan allows you to work with that patient in a variety of ways now. So certainly, we're foundationally working with practices that provide hearing health care through hearing aids and instruments. And a scan can be used to customize that device, also to customize the mold that goes with the devices that you mostly fit, which are the RIC devices. But that scan is still available for you and that patient for anything that they want to customize. It's my belief that practices like yours and others should be the ear center for the patient. And that means anything they might put in their ears, including headphones, including AirPods, hearing protection, swim plugs, sleep plugs, anything you can imagine, can be customized with manufacturers by using the 3D ear scan. So I think, in my perspective, taking the 3D ear scan of your patient allows you to have a different, broader relationship with them than you would have otherwise. And you wouldn't have gone down that path in all those different arrays because you would have had to take another silicone ear impression every time for every application. So I really believe that it gives you a stronger, stickier, broader relationship with your patients. And of course, everything custom to the patient means they don't need to use as much volume. It stays in their ear. They don't have the feedback issues, and it's comfortable. Imagine that. And I'm sure also in this time when you're dealing with masks, and masks are pulling hearing aids off. If that hearing aid or the mold was custom, it's going to stay in place a lot better.
That is very true. We saw a lot of lost hearing aids during this pandemic, for sure. So, FCOM, you've been here and this is your first experience at this type of meeting. And our goal of the meeting is really to bring all providers that would interact with the patient into the same place so that we're all learning from the same playbook. How do you see that impacting our patients and their journey in their hearing health care?
Well, first of all, I'm grateful to be a part of this group and this event. I can certainly tell you, even for the few days I've been here already, we'll definitely be sponsoring and be a part of this because you brought the right mixture of people together. We have the physicians, we've got administrators, we have the audiology community, and then all of those that have been here to support those efforts. The conversations have been phenomenal. It's small enough but big enough where everyone's flowing together, but also the setups like this, like the different panels you have, the different presentations you've set up, the virtual setup as well. It's clearly the people that you've chosen to partner with are clearly focused on how do we broaden out from where we are here in Florida to other groups. How do we not just say we want to be patient focused, but prove it with trying to improve our processes. And the interactions I've had have been phenomenal. So I'm proud to be one of your partners and look forward to helping you grow.
Absolutely. Well, we certainly look forward to having you with us next year.
Fantastic. Thank you.